Hi guys, let's see the review of Nelson Textbook of Pediatrics, volume number 1, edition 21st. In this video, I will discuss from the chapter number 5 to 8. First, the chapter number 5 is nutrition. Chapter number 6, fluid and electrolyte disorders. Chapter number 7, pediatric drug therapy. And chapter number 8 is emergency medicine and critical care. In first part 5, nutrition. Here, first the chapter number 5 is nutrition. Here nutritional requirements, then dietary reference intakes, energy, then about the graph for dietary reference intake relationship among the estimated average requirement, then about the fat, then tabular column for acceptable macronutrient distribution ranges, then dietary reference intakes of macronutrients, then about the pie chart of food category sources of saturated fat in US population, then about protein, then about the food category sources of added sugar in US population, then about fiber, macronutrients, micronutrients, carbohydrates, micronutrients such as like iron, and the tabular column for dietary reference intake for vitamins like biotin, like vitamin B7, then about choline, niacin, vitamin B3, all those things are given. Then about pancytonic acid, riboflavin, thiamine, vitamin A, diagrammatic tabular column is given. Then about like vitamin D, calcium, vitamin K, electrolytes, water. Then about chapter number 56, feeding healthy infants, children and adolescents, like breastfeeding, nipple pain, mastitis, like patterns of milk supply, the tabular column is given, like selected beneficial properties of human milk compared with infant formula. Then about mastitis, inadequate milk intake. Then about jaundice, breast milk collection, and the flow chart is given for feeding algorithm for term infants. Then about my plate food guide is given in the picture. Then about conceptual framework for the context of food and lifestyle choices. Then about nutritional food security and health, the diagrammatic representation of 14-year-old girl with flangy pain dermatitis, and here in 57.3 figure, paired transverse homogeneous and smooth border lines notch in all the fingernails of like infant for diluted cow's milk since birth. And about here the flow chart is given for the immediate causes undernutrition, and here measuring mid upper arm circumference. Then about the child with severe wasting, then child with generalized edema. And here table column is given. And about refeeding syndrome, then malnutrition like clinical symptoms, etiology, diagnosis, treatment, prognosis, etc. And here the defining malnutrition in hospitalized children, then about overweight and obesity. Here the graph for 2 to 20 years boys BMI in percentage, then about for girls, then about endocrine and genetic causes of obesity like endocrine factors such as Cushing syndrome, growth factor, then like hyperinsulin, hyperthyroidism, etc. Then about genetic factors, all those things like genetic factors, deletion, Bardet-Biedl syndrome, all those things are given, like Turner syndrome. Then about the regulation of energy hemostasis by the brain gut adipose axis. Then about the brain structure involved for energy chemostasis is given. Then about acanthosis nigrinus. Then about the flowchart for diagnosis and management. Medications for weight management for the mechanism, availability and dosing. How much dose should be given. Then about bariatric surgical procedures like laparoscopic adjustable gastric banding is given in the picture. Then about vitamin A deficiency and excess. Overview of vitamin A, like metabolism of vitamin A. Then seroophthalmia, it is good because of vitamin A. Then about hyperostosis of ulna and tibia. Then about vitamin B complex deficiency and excess. Glossitis as seen in children like riboflavin deficiency. Then about biotin like scalp rash before the treatment with biotin. Then folate deficiency like hyperpigmented knuckles, that is vitamin B12 cobalamin, cyanocobalamin. Then about vitamin C. Then about vitamin D deficiency and excess like rachitic rosary in children with rickets. Hands and forearms of young children with rickets, like void sept deformity of legs in old child. And then about the radiological findings. Then about vitamin E, such as like causes, pathogenesis, clinical manifestation, laboratory diagnosis, treatment, prognosis, etc. Vitamin K, same as like causes, pathogenesis, clinical manifestation. Then about metabolic acidosis, etiology and pathogenesis. Then about clinical manifestation, diagnosis is given. Then metabolic alkalosis, the same like etiology, pathogenesis, diagnosis, clinical manifestation, treatment. Respiratory alkalosis. Then chapter maintenance and replacement therapy. Then about pediatric drug therapy, pediatric pharmacogenetics, pharmacogenomics, and pharmacoproteomics. The three terms, the definition is given here as a brief. Then about like how examples of effects of gene polymorphism on drug response. Then representation of pharmacogenomic data. Then like GYP2D6, then GYP2C9, GYP2C19. These are the genes are given. Then about mechanism of drug action. Then about antidepressants drugs, anti-epileptic drugs, antipsychotics and major sedatives, benzodiazepines, other pain control medications. Then poisoning, prevention, approach to poison patient history, principles of management. Then emergency medicine and critical care. In this first, emergency medical services for children, like primary care, physician and office preparedness, staff training and continuing education, like protocol should be there. Then resuscitation equipment, that is very important for the healthcare for emergency medicine. Here the emergency medical service for children is given. Then about transport options with a coordinated regionalized emergency medicine service system model. Then about triage of acutely 3 child. Then about physical examination, management, disposition, all those subtopics are given. Then pediatric emergency and resuscitation. Here the basic life support healthcare provider is given in the flowchart. Then in this like airway obstruction, here in this picture like how to resuscitate a baby, opening the airway with the head tip chin lift maneuver, and then next here rescue breath in infant, rescue breath in a child, how should we do, and black blouse and chest thrust bottom. Then about abdominal thrust with the victim standing or sitting, abdominal thrust with the victim lying. These are the resuscitations. Then about airway narrowing. Then about endotracheal intubation, how should be done. That is given in the picture like appropriate sizing technique for pediatric bag wall mask apparatus. Then here intubation technique is given like A, B, C, D and E is also there. Then about bradyarrhythmias and tachyarrhythmias. Here the pediatric advanced life support tachycardia algorithm. And here cardiac compression for child with CPR, performing CPR. Then thumb method for chest compression. And here pediatric advanced life support pulses arrest algorithmic. And here veins of the lower extremities of the child is given like great saphenous vein, superficial veins and deep veins. Here femoral vein approach is given. Then about internal and external jugular veins. And this is for radial artery anatomy and cannulation. Then acute care of multiple trauma, epidemiology. Then here the Staff ED trauma by Johns Hopkins Hospital. Here radiological findings are given like liver injury, splenic rupture. Here different forms of brain herniation. Then here radiological diagnosis and differential diagnosis like epidural hematoma, subhematoma, skull fracture, subdural hematoma. Then syncope. The main one is sudden transient loss of consciousness. Postural tachycardia syndrome, like examples of neutrally mediated syncope. Then about shock, their clinical manifestation, diagnosis, treatment. And the tabular and this flowchart is for hypothetical pathophysiology of septic processes. And about respiratory distress syndrome. And for acute respiratory distress syndrome, the normal chest radiograph and how the radiological findings will change it for acute respiratory distress syndrome. Here for neurological respiratory patterns in neurological disease for normal and for cortex, midbrain, pons, medulla and pons, how this ECG will go. Then about burn injuries, first epidemiology like prevention, how should give like emergency care, then about the treatment, and there are 4 phases of burn care. Then T-scar over the chest and shoulder of the child showing heterogeneity of the burn depth. Then about the last here electrical burns. Then about common long-term complications with disabilities of bone injury and electrical injury. These are the things. Thank you.